he's working in the community, whether he's involved in policy research, in organisations, whatever it is, everyone who's here has a reason for being here because they have a role in listening to what people have to say. As you travel around the city or live in the city, do you think in most of the places you go to?
Yeah, I'd be saying ask the leave or something, because I wouldn't look like, I wouldn't have to wait, or I would look a bit thin, or I would look a certain way, or I wouldn't be dressed this way, or I'd be dirty a bit, or because I'm living on the streets or something. So because he had a suit on him, oh yeah, come on in, you, ready to go.
And what do you think that does to people? How do you think people feel with arms?
It's stigmatised.
The environment that you grow up in has a lot got to do with how you're going to turn out in 20 years or 30 years. So when I was young, I grew up in Maidstone and I was in the middle of nowhere. So there was nothing for us to do. The city centre, that's where we went. And that's where everything was happening, nightclubs, and that's how I got into things. I've been around the city all my life. I picked this part. In some places I feel belong, but most places I'm looked at as an undesirable and just a person who uses drugs and he's no good.
No one is asking you why are you taking drugs.
The most marginalised, communities, and then the most criminalised, targeted communities because they are poverty. I'm now meeting kids from friends that I know that have died, and they're dealing with the same trauma, the same issues, and they're asking me, I even feel sad thinking about it now, what their parent was like. This needs to stop.
If you look back, it was probably just trauma and the use of drugs to alleviate the trauma that was the problem. So the criminalising from the very beginning and the road that leads down usually is seen as an answer or a solution that will help people, but for a lot of people it just makes things worse.
Born into the trauma and into the whole lot of it, and if the drugs are a solution, let's look at the problem. What's the problem? And a lot of the problems stem from these buildings on this floor.
These are solutions, policies that create equality and stronger communities.
Don't see many children in care in the outer areas. It's always the inner city areas, poverty areas, most marginalised areas. No one understands that community. No one understands how those communities work.
I came through the social worker system myself. I came through the social worker system. Now I have a granddaughter. It's sort of like a ripple effect.
My last custody, my son just left. They don't mean no favours whatsoever. He actually ruined my life, to be honest with you, and my son's life. Now it's a ripple effect because what happened to me is actually impacting on my son. So he's out on the streets now, and he's doing what he's seen growing up. It's not all doom and gloom. I bought the system. I ended up getting housed about 7 months ago, and I got custody back of my son.
I know 80 social workers in training in minutes, and I think I would like to get open conversation with Ishka and then social workers.
You can have a full-blown conversation with a doctor for 10 minutes and all he hears is the person that uses drugs, and you're treated accordingly, you go into nurses, everything. Once you're using drugs, the stigma is automatically in there.
We have safety net here, so doctors who understand the impact of trauma and social damage, instead of doctors that just come in and say to you, how do you feel today? Oh, I'm not well today, well, you'll feel another 10 minutes, Not you want to come down another 5 and maybe another 5 in 2 weeks, Mental health services inclusive of dual diagnosis, which we don't have. Like if you have a mental health issue and you have a drug problem at the same time, you have a drug charge and you go to a police station, they haven't got a psychologist for mental health. Very hard to get one in prison.
Mental health for me was coke, crack, used as a guinea pig, have every tablet under the sun, see that work, that not work, will work, won't work. Then they put you out in your home still, nowhere to go. I go back to those drugs, what's the point?
It's very hard to get psychiatric help. The waiting list is going to be, you might be dead again, you come on the waiting list,
Sadly, addiction services has been the most resistant, along with mental health, the most resistant services to person-patient centeredness, to going up to somebody and saying, tell me what you need, and let's see what we can do to build the services around you.
The drug checking on street levels to know what's in the drugs, because there's a lot of drugs being mixed now. There's a lot of overdoses.
Most of my friends are all dead now through drug use.
See all these little yellow sticks? They're naloxone kids. if anybody could get at any time, all these people that are lying down, most of them could have been saved by a family member. That should be a household item.
We give training, and myself being homeless, I have saved a life, and I've also seen a girl live and not being able to save a life because I was told by the hospital that I wasn't allowed to have the naloxone. So that girl left in an ambulance and never seen the girl again, you know, so I don't know whether she's alive or dead.
Anybody who's involved in services and policies, anything should be hearing your voices. What would you like to see happen?
We want to bring it and show it to people.
Changes in the policies, changes in the way people perceive us or people who use drugs are perceived.